During periods of inactivity, blood clots commonly form in the legs of many persons. These clots can sometimes dissolve on their own, especially if they occur after a healing injury. Blood clots, that form as a result of events such as surgery, on the other hand, are far more dangerous. Deep vein thrombosis, or DVT, is a type of thrombosis that occurs in the body's deep veins. These clots can break off and move through your veins, causing a pulmonary embolism. As a result, they have the potential to cause havoc with your system. This terrible sequence of events can result in heart attacks or strokes. The most frightening aspect of blood clots is that they frequently occur without warning. They work by preventing blood from leaving your organs and returning to your heart. This results in a major health problem. Here are 10 signs you should look out for in your health to see if you have a blood clot. Number 1. Lethargy or fatigue. Fatigue might sometimes be a sign that you aren't getting enough sleep. There are, however, a variety of additional causes of fatigue that can be fatal. Medication side effects, cancer, cardiac problems, and blood clots are all possible reasons. You may not know the exact cause of your exhaustion unless you contact a doctor and undergo diagnostic procedures. Furthermore, you may be unaware that it is endangering your health. If a blood clot is a reason, your muscles and brain are most likely not getting enough oxygen. When a blood clot prevents blood from returning to your heart, you lose crucial oxygen and energy. Tiredness may be the first symptom of a blood clot. In any event, you should see your doctor if you're experiencing unusual lethargy. Number 2. Varicose veins, redness, and swelling in the legs. Varicose veins are bluish-purple or red in appearance, and they most commonly occur in the legs. They're also known as spider veins and form when your veins expand, widen, and overfill with blood. Overfilling weakens them, causing them to seem twisted just beneath the skin's surface. Varicose veins are dangerous because the blood that travels through them is sluggish. Blood clots form as a result of this. Fortunately, varicose vein blood clots do not go to the lungs and cause a pulmonary embolism. It is, however, something you and your doctor should keep an eye on. An embolism is a rare occurrence, but it can happen. Number 3. Shortness of breath. Shortness of breath can occur for a variety of causes. Asthma, pneumonia, anemia, anxiety, an allergic reaction, and obesity are just a few of them. Shortness of breath, on the other hand, can indicate the presence of a blood clot. When a blood clot forms in your veins, it has the potential to break free and travel into your heart. Then it travels to your lungs and cuts off your blood supply of oxygen. This could be a life-threatening situation. As a result, you should seek medical help right away. Shortness of breath is a common symptom of heart or lung disease, and it restricts your ability to operate normally. Number 4. Pain with breathing or other chest pains. When chest discomfort comes, most individuals automatically assume they're suffering a heart attack. They are, however, unaware that the heart problem could have been caused by a blood clot. As a result, any chest aches you may be experiencing could be a sign of a blood clot. These are extra warning indicators if you are sweating and breathing deeply is difficult. A pulmonary embolism is caused by a blood clot that causes acute symptoms in the chest, according to experts. If your chest feels as if it's carrying a heavy weight, you may have a heart condition. It's important to understand that both of these feelings can put your life in jeopardy. Number 5. Sweats and fever. A fever is experienced by about 14% of persons who have a pulmonary embolism. The presence of a blood clot is linked to inflammation, according to one theory. The tissues impacted by a blood clot become warm to the touch when they become inflamed. A fever might also be caused by advanced blood clots that travel into your veins. You may begin to sweat as a result of the fever. If you have a blood clot that causes cardiac arrest, you may also feel sweating as a symptom. Number 6. Fainting and dizziness. Patients with blood clots are forbidden from flying, according to doctors. The obligatory sitting time on an airline flight will worsen any clots that have formed in your legs. It may spread to other parts of your body as a result of this. Furthermore, the change in air pressure caused by flying may cause blood clots to form in your heart or lungs, causing a blockage. This may result in dizziness or fainting. The flow of oxygen to your heart, lungs, brain, and organs is disrupted when a blood clot forms. When your oxygen supply is interrupted, you should constantly be aware of the potential causes. If you're flying, attempt to move your legs at regular intervals to keep your blood flowing properly. If you are on the ground and have dizziness or fainting spells, you should seek medical help right once. Number 7. Fast heartbeat. Your heart rate should be between 60 and 100 beats per minute if you are an adult. Other factors, however, have a role in determining what is considered a normal heart rate. To begin with, your definition of normal is influenced by your age, physical size, and gender. It also relies on what you're up to when you take your pulse. Medication, air temperature, emotional state, and heredity are some of the other variables to consider. Because there are so many different heart rate components, you should always be aware of what your individual normal should look like. When a blood clot forms, your heart rate will most likely increase. Because of the clog and insufficient oxygenation, your heart has to work more to keep your body running smoothly. Do not take a faster heart rate for granted. Number 8. Persistent unexplained cough. You might be suffering from a pulmonary embolism if you're coughing up blood. As a result, you should seek medical care as soon as possible. As previously said, a loose blood clot is most likely to lodge in your lungs, putting your life in jeopardy. Furthermore, when something becomes stuck in the lungs, the body's natural response is to cough. If your cough isn't caused by a cold or allergies, it can last longer. Furthermore, determining that it is a clot takes time for the doctors who examine you. You are wasting valuable time if you do not get to them quickly. Number 9. Blood in your expectorant. Blood in your body fluids should be a cause for concern. It could be an indication of something more serious than you aren't aware of. Your phlegm should never be bloody when you cough. Your respiratory membrane and passageways are healthy if you have phlegm. Bloody phlegm, on the other hand, signals that you're in trouble. You should see a doctor straight away to see if you have a blood clot or something else more serious. Number 10. No signs at all. Until the clot lodges, you may not see or experience any signs that something is wrong. This is harmful and leads to a slew of consequences, many of which result in death. As a result, if you're at a higher risk for blood clots, keep a close eye on your development. Consult your doctor about getting regular exams so you'll know if anything is wrong.